call on George Adam to be followed by Jim Hume. Up to 7 minutes.
Thank you, Presiding Officer. Presiding Officer, I welcome this debate and in particular the serious tone and constructive tone of the debate, because this is too important a subject for us not to treat it with this type of respect. I welcome the bill and the need for integration of health and social care. And, Presiding Officer, I believe that a society is judged on how we care, help and support our older people, our vulnerable and those with long-term conditions. And I believe that this bill does focus on these issues. I appreciate that the Cabinet Secretary has explained the length the Scottish Government have gone to regarding integration and engagement with health and social care professionals and users, as this is too important an issue, as I have said, and one we must get correct first time. The changing shape of Scotland's society and more older people and an ageing population is something of a challenge that we have all had to face for a number of years now. I remember my time in Renfrewshire Council, where one of the first things as a member of the Scrutiny Board, we discussed demographic change and the challenge of this and how we could deliver services as a local authority. And I know other authorities have looked at that as well. And as the Cabinet Secretary quite rightly says, Presiding Officer, there are many councils and many organisations working together towards these joint goals to ensure that they can deliver for our people in our communities. But improving the outcomes for the families and the carers in our community, and the focus on this part of the bill, is the most important part for me, because at the end of the day it's people's lives that we are dealing with, and we have all had various stories as elected members of situations where the system has not worked. And we have to make sure, as elected members, that we can make a system where it can be seamless for people to go through the system as well. The Cabinet Secretary is correct that public agencies and organisations must share the challenge and work together, and moving away from silos and silo management ideas, because this is something that I have experienced, whether it be with my wife with her long-term conditions, or with constituents who have difficulties trying to access the services that they need to access. But I would like to go on from my local government and local council background. During that time, I got a great belief in the work that social work did within our communities. And I saw as a councillor what they did, particularly with older people and some of the groups that they deal with. And one of the stories I had was one that was as simple as an older man who was effectively coming home to die, and his wife, they're both in their 80s, and we couldn't get the care package in place to get the elderly gentleman home. And the wife was extremely worried by this. Now, it took a phone call to me to social work to actually be able to get that done. And for me, that's the difference with social work at a local level, is the fact that I, as an elected member, can contact the social work department in the council and get something done, where it can be rather difficult with the health boards to do something likewise. It's my belief that I was actually, if I asked the local health board, it would be even more difficult. But 1 in 12 people use social work services at one point in their life. The social work departments in our council are protecting children, supporting people with mental health issues, people with addictions and people with learning disabilities. So let's not forget the role that social work has and the accountability that it has to local communities. The success of the services offered by social care staff and their commitment working in very challenging situations must be recognised, as many are driven to help and work beyond the call of duty to protect and care for our vulnerable people within our communities. Integration must take all of this into account. As I said, frontline staff will be the key to making integrated service a practical reality, and it is the skills and staff within health and social care that will deliver and the results that we all want. If I can mention that it will take leadership and management. We need effective, robust and innovative leadership at all levels that will be central to the success and transformation programme. In particular, it will be crucial to have a clear focus on putting leadership by social workers, care professionals and clinicians at the heart of all integrated health service delivery. As Cabinet Secretary said, we must move away from organisational silos, but we must retain the services that do actually work. I welcome the bill to deliver the outcomes of the individual, the family or the client. Integration being delivered locally is extremely important, and ensuring that it is accountable is equally as important. I think the idea of the Chief Accountable Officer will help in that accountability, obviously working with the Health Board and with social work at local council, bridging the gap between the Health Board and the local authority. The NHS and social care staff are the ones that really have to deliver this, and we have to ensure that they buy in and work with us on this as well. And we have to make sure we use all their talents. But this change isn't new to people in local government and social work. Social work services have operated in an integrated manner across the range of needs in their communities, and have been particularly strength for Scottish social services over the last 40 years. So we need to tap into that practical professionalism and expertise. And the integration of health and social care is indeed a radical new way of working for our health and social care professionals. But we need to ensure that that expertise of the local social work departments, of the health experts across Scotland, are not forgotten. As the Cabinet Secretary says, many of the partner organisations are working this way already. We have to ensure that they continue to work that way. And let's hope, like Ian Gray already said, we aren't coming back here in 20 years' time and having the same conversation. Thank you, Presiding Officer.
Thank you very much.